If you could leave one lasting impact through your research, mentorship, and advocacy, what would you hope that impact to be?
I would hope that people understand that gun violence is a uniquely American problem. It's baked into the DNA of this country and it's baked into the US Constitution. And so we think about gun violence. It's not an issue which is race specific, it's not gender specific, nor class specific. This is a uniquely American problem. America has more guns circulating than citizens. We have the highest rate of gun violence in the world. We have the greatest number of guns. And so we have to all be invested as citizens in addressing this uniquely American crisis. It's not a crisis that will not end up on the front doorstep of any American. It can happen to you in a blink of an eye.
Welcome to another episode of our Global Health interview series by 72 Dragons Health, a branch of the global production company 72 Dragons, focused on health and wellness. Each episode is a deep dive into the journeys, challenges, and breakthroughs shaping global health today. However, this is not just about listening. It is about learning, reflecting, and engaging in a global conversation on how we care for our communities. From innovative frontline leaders to visionary policymakers, our guests are driving real change, and we are here to share their stories with you. Of all the forms of inequality, injustice in healthcare is the most shocking and inhuman. Dr. Martin Luther King Jr. Today, we're honored to welcome Dr. Joseph Richardson, Empower Professor of African American Studies, Medical Anthropology, and Epidemiology at the University of Maryland, whose pioneering work addresses gun violence, trauma, mental health, and community-based interventions. Dr. Richardson directs the Transformative Research and Applied Violence Intervention Lab, TRAVAIL, and leads Prevent Gun Violence Research Empowerment Strategies and Solutions, PROGRESS, uniting diverse disciplines to develop innovative, community-driven solutions to prevent gun violence. Dr. Richardson's award-winning documentary project, Life After the Gunshot, highlights the experiences of survivors, reshaping narratives and influencing policy. Dr. Joseph B. Richardson, a current APHA member, was elected to the National Academy of Medicine, recognizing his essential contributions to addressing urgent health challenges. We're truly delighted to welcome you, Dr. Richardson.
Thank you for having me.
Dr. Richardson, looking back at your early academic years, which subjects or experiences first sparked your interest in criminology, medical anthropology, and public health? How did that curiosity guide your career path?
When I was an undergraduate at the University of Virginia, I majored in African American studies. And during that time, I had taken a class in drugs and social policy. And it was that class that really sparked my interest in criminology. And quite frankly, to be quite honest with you, I'm a big movie buff, and I was an avid fan of the film Silence of the Lambs with Jodie Foster. And that really also ignited my interest in criminology and forensic science. And at that point in time, I was very interested in either becoming an FBI agent or Secret Service agent. And during my first year in graduate school, I had the opportunity to have a summer internship at the Department of Justice, the National Institute of Justice, which is the research arm for the DOJ. And during my internship, I had the opportunity actually to visit the FBI training academy in Quantico, Virginia, and I met the consultant for Silence of the Lambs. And that was really interesting. So that was the beginning of it. That led to my interest in criminology and criminal justice.
Thank you. Very interesting journey. Now, your digital storytelling projects, such as Life After the Gunshot, have brought attention to the lived experiences of gun violence survivors. How do you see narrative change shaping public health interventions and policies?
I think narrative change is critical in moving our science beyond just placing research and findings in a peer-reviewed journal and behind a paywall that becomes inaccessible to the populations that we work with. And so for me as an ethnographer, I was always interested in using a visual medium to convey my research. And it was very challenging for me to present at conferences with PowerPoint slides, and the PowerPoint slides reflected the quotes of the people. As someone that was actually there, I really wish that people could see and hear the young people and the parents in many of my studies that I've worked with. And so as a postdoc at the University of Chicago, I decided to take documentary film classes at Columbia College, which is the arts college based in Chicago. And that led to me grabbing a camera and an audio kit every week. And then I filmed a short documentary there. And then eventually further into my career as an assistant professor, I decided to integrate film into my studies. And I think with the day and time that we live in now with social media and digital media platforms, it's almost mandatory that you have a visual medium so people can literally see the science. And so that was the importance of Life After the Gunshot for the world to be able to see and hear the young men who have experienced violent injury, but also to integrate their narratives in a compelling way that is supported by science. So it's weaving their narratives in with the science and supported by science. And people really appreciate that approach. And we recently screened our second episode in Dallas. And one of the things that we consistently heard back from the audience in our Q&A after our premiere screening was the way that we seamlessly integrated the data into the storytelling. So that's really the strength of the narrative change for our approach.
Now, mentorship appears to be central to your lab, the Transformative Research and Applied Violence Intervention Lab, TRAVEL, and other initiatives. What advice do you give to students and emerging researchers who want to pursue interdisciplinary work in public health and social justice?
I don't think you can do the work now in a vacuum, in isolation and hiding behind your silo. It's going to take a multidisciplinary approach. And interestingly enough, I spoke to one of my mentees yesterday, and he was trained as a criminologist and is on the job market. And he felt that he could only apply to departments of criminology. But when I mentioned to him the interdisciplinary nature of doing gun violence research and the ways that it intersects public health and social work and medicine and medical anthropology, it really touched the light bulb in his head. And he had never thought about the interdisciplinary nature of his work. And so even in terms of expanding the scope of his job search and not limiting it to specifically criminology departments, he's now thinking about, oh, well, I can apply to a school of public health or to a school of medicine or a department of anthropology or a school of social work. And that's really what I try to get across to emerging scholars is the gun violence research touches every aspect of social science, public health, social work, and now computer science. My newest project, I'm working with AI scientists, and we're establishing Geo AI project to engage in predictive CVI. So it can also touch technology, social media. I have another project with my colleagues where we're looking at the intersection of social media and gun violence. So it's quite interdisciplinary, and I would just encourage emerging scholars to be really bold and take risks with their science and ideas.
It's definitely more complex than most people think, as you describe. As a member of the American Public Health Association, APHA, and elected to the National Academy of Medicine, How do you see professional associations and national bodies influencing policy and community level public health interventions?
APHA and organizations with that level of visibility globally definitely have the influence on social policy and global policy. And so, again, I've been attending APH conferences since the beginning of my career, and it's given me a platform to showcase the research that I'm doing, but it's also given me a platform, even most recently, to screen life after the gunshot. So this year, APHA has honored us with the opportunity to screen our documentary film. And so people who may live outside of the United States also have the opportunity to see what life is like for young Black men who have experienced gun violence and how they're coping with the aftermath of their injury, both psychologically and physically. And for those who may not know, we're now reversing back to where we were with the Dickey Amendment. And the Dickey Amendment had essentially restricted gun violence research funding for a number of years, almost 2 decades. So here we are again with the pendulum swinging back after we've had since 2020 a significant increase in gun violence research by the federal government. And now we're at the point where many gun violence researchers are solely relying on private philanthropy to support our work, which is unfortunate considering the cost of gun violence to this country. So yes, APHA and other organizations such as SAVOR, and I definitely want to make sure I uplift SAVOR. And I also want to uplift my own organization that I started with my colleagues, Shawnee Buggs and Jocelyn Fontaine, and so many other scholars that were responsible for engaging in the development of the collective, which is the Black and Brown Collective for Solutions to Gun Violence Research. And the reason why that organization was started basically 2 years ago is because Black and Brown researchers had been ignored in the gun violence research space and marginalized, and our voices were not being heard. They were muted. And so that organization also has the support of many national foundations to support the gun violence research that we're doing in communities that are disproportionately impacted by gun violence and also suffer from a lack of investment, many respects, significant disinvestment. And we have decided that we've had enough of having our voices muted in the communities where we work, where those voices have been silenced as well. So I wholeheartedly support the work that APHA has been doing.
Thank you. Now, if you could leave one lasting impact through your research, mentorship, and advocacy, what would you hope that impact to be?
I would hope that people understand that gun violence is a uniquely American problem. It's baked into the DNA of this country, and it's baked into the US Constitution. And so we think about gun violence. It's not an issue which is race specific. It's not gender specific nor class specific. This is a uniquely American problem. America has more guns circulating than citizens. We have the highest rate of gun violence in the world. We have the greatest number of guns. And so we have to all be invested as citizens in addressing this uniquely American crisis. It's not a crisis that will not end up on the front doorstep of any American. It can happen to you in a blink of an eye. That gun violence can impact anyone in this country at any given time. And so we all need to be invested in addressing it.
Thank you. Dr. Richardson, thank you for sharing your incredible journey with us today. Your groundbreaking work in gun violence prevention, trauma care, and health equity is truly reshaping communities and inspiring change. Thank you.
Thank you.
Please share your thoughts in the comments below. We would love to hear your perspectives and continue this important conversation. Make sure to like this video and subscribe to our channel for more inspiring stories from global health leaders.